Hydronephrosis. Hydronephrosis describes hydrostatic dilation of the renal pelvis and calyxes with urine, may be due to obstructive, physiologic, or secondary to reflux. It can occur at any age and sometimes is spotted in unborn babies during routine pregnancy ultrasound scans. This is known as antenatal hydronephrosis. Hydronephrosis can be sudden or chronic, partial or complete, unilateral dilation of one kidney, or bilateral dilation of both kidneys. Incidence. Acute unilateral hydronephrosis is more common than bilateral hydronephrosis. Hydronephrosis among women occurs more often between age 20 and 60 years. In men, it most commonly occurs after age 60. Hydroureter. Hydroureter is the destination of the ureter with urine due to obstruction. Can happen with other problems of the urinary tract, but it can also be the only condition present. Pathophysiology. Obstruction leads to build-up and backflow of urine, increasing pressure inside the ureter. This will lead to changes in GFR, tubular function, and renal blood flow. GFR rate decreases, and sodium and potassium reabsorption and secretion in the renal tubulus are disrupted, affecting the ability to concentrate and dilute urine. With obstruction in the urethra or bladder, hydronephrosis is usually bilateral. With obstruction in ureter, hydronephrosis is usually unilateral. Obstruction distal to the bladder causes the bladder to dilate, acting as a buffer zone, leading to delaying hydronephrosis. When a bladder is unable to empty, the pressure will transmit it to the kidney, leading to build-up of fluid. Causes can be categorized into ureter level causes, bladder level causes, and urethral level causes. Ureter level causes include the following: uretropelvic junction obstruction, uretrovesical junction obstruction, urinary tract infection, ureteral calculi, papillary necrosis, ureteral stricture, ureteral tumors, endometriosis. Pregnancy, abdominal aortic aneurysm, ovarian cyst, inflammatory bowel disease, cervical cancer, uterine prolapse, prostate cancer, diverticular disease. Bladder level causes include neurogenic bladder, bladder calculi, bladder neck contracture, vesico-urethral reflux, bladder diverticulum, and cystocele. Urethral level causes include urethral stricture, urethral valvus, urethral diverticulum, benign prostatic hyperplasia. Symptoms vary depending on the cause, including flank pain, abdominal pain, dysuria, nausea and vomiting, bloating. Alternating oliguria, low output of urine, polyuria, excessive or abnormal large production or passage of urine, and anuria, non-passage of urine. Physical findings include hematuria, pyuria, palpable kidney in severe cases, edema in lower extremity due to bilateral hydronephrosis, crackles, palpable abdominal mass, hypertension, and costovertebral angle tenderness. Complications include urinary stasis, spontaneous rupture of the renal calyx, progressive cortical atrophy, kidney failure, POD, and sepsis. Diagnosis. First, imaging, ultrasonography, confirm the diagnosis and identify or rule out an obstruction. Voiding cystourethropy reveals vesico-urethral reflux. IV urography shows the site of the obstruction. Radionuclide renal imaging shows the site of the obstruction. Nephrotomography shows delayed appearance time. CT scan of the kidneys may reveal the cause. KUB radiography may identify abnormalities or blockage in the urinary system. Cystourethropy may perform to visualize the inner surface of the urinary tract. Second, laboratory. CBC test may reveal anemia associated with kidney failure or leukocytosis if infection is present. GFR decreased, creatinine, urea and potassium level elevated. Urine analysis may show hematuria, proteinuria, crystalluria and pyuria, and urine studies confirm the inability to concentrate urine. BUN may be elevated in bilateral hydronephrosis. Treatment. General treatment of the cause of the problem, urinary catheterization, drainage of the kidney using a nephrostomy tube placed temporarily or permanently in the renal pelvis, urethral stenting. Medication include antibiotic therapy for infection or vesicourethral reflux, non-steroidal anti-inflammatory drugs or codeine phosphate acetaminophen for renal colic, IV morphine, phenazopyridine for urinary tract discomfort, oral alkalization therapy for uric acid calculi. Diet. If kidney function is affected, low protein, low sodium and low potassium, increase fluid intake while avoiding coffee, tea and carbonated beverages. Surgery include dilation of urethral stricture and placement of urethral stents, prostatectomy for benign prostatic hyperplasia, urethrolysis for retroperitoneal fibrosis, urethral reimplantation for vesicourethral reflux, endoscopic surgery for removal of calculi, blood clots, scar tissue and other obstruction, placement of percutaneous nephrostomy tube, extracorporeal sound wave lithotripsy or endoscopic lithotripsy for stone obstruction. Monitoring include kidney function, monitor intake and output, fluid and electrolyte balance, check vital signs and pain level, wound site, catheter drainage, and sign and symptoms of infection. Nursing diagnosis. 1. Impaired urinary elimination, goals promoting adequate urine output. Nursing intervention include monitor input and output every 2 to 4 hours, palpate bladder, prepare for catheterization, nephrostomy, encourage regular voiding, monitor electrolyte, document urine characteristics. 2. Acute pain related to urinary tract obstruction, goal reducing pain. Nursing intervention include assess pain using scale, administer analgesic, apply warm compresses, encourage relaxation, position for comfort, reassess pain after interventions. 3. Disturbed sleep pattern related to pain, goals improving sleep quality. Nursing intervention include administer pain relief before sleep, create a restful environment, limit noise, adjust nighttime care. 4. Imbalanced nutrition less than body requirement. The objective, maintaining adequate nutritional intake. Nursing intervention include monitor food intake, control nausea and vomiting, and medication, provide a small high-calorie meal, wait regularly and refer to dietitian if needed. 5. Anxiety related to diagnostic procedure, goal reducing anxiety. Nursing intervention include explain procedure clearly, offer emotional support, encourage questions, use calming techniques, allow presence of support person. 6. Deficient knowledge related to condition and management, goal educate the patient. Nursing intervention include assess learning need, use simple term, provide written handouts, reinforce sign and symptom to report, and involve family in teaching. 7. Risk for impaired renal function, goal maintaining stable renal function. Nursing interventions include monitor renal lab, BUN, creatinine, GFR, notify provider of any change, encourage hydration, monitor blood pressure, prepare for dialysis if needed. 8. Risk for infection related to urinary stasis, goal preventing urinary tract infection and maintaining sterility. Nursing intervention include maintain sterile technique with catheter, encourage fluid intake, monitor sign of infection, educate on hygiene and symptoms of urinary tract infection, collect urine culture if needed. 9. Risk for fluid volume excesses related to renal dysfunction, goal preventing fluid overload and maintaining fluid balance. Nursing interventions include monitor input and output and daily weights, assess for edema and lung sound, follow fluid restriction, elevate extremities, and administer diuretics.